You may have heard about some people being on a 10-day quarantine and others on a 14-day quarantine. Wondering what the difference is? We're here to explain. If you test positive for COVID-19, the Centers for Disease Control and Prevention recommends, and the St. Charles County Department of Public Health requires, that you be placed on at least a 10-day quarantine, and that you isolate yourself from others, even those within your household. This 10-day quarantine is based on CDC studies that show symptomatic and asymptomatic positive cases generally stop spreading the live virus after 10 days. In order to be released from quarantine, you must be fever-free and experience an improvement in your symptoms without being on fever-reducing medications during the last 24 hours of your 10-day quarantine. A 14-day quarantine is required for anyone who is a close contact or household contact to someone who tested positive to COVID-19 or is a probable case. This mandatory quarantine and isolation for 14 days starts after the last exposure to a COVID case. The incubation period for this virus is up to 14 days, meaning someone could develop symptoms, test positive, and spread the illness to others at any time during that period. If and when that person tests positive for COVID or develops symptoms consistent with COVID and has had a known exposure, they would then start a 10-day quarantine. We hope this helps clear up any questions about the differences in quarantine periods. If you have questions, call the St. Charles County Public Health Hotline at 636-949-1899 or visit sccmo.org/COVID.